All y'all, it's Dr. Barbie. This video is going to talk about some of the ways that muscles are named. A lot of times muscles are named for their physical features or their actions. Many muscles have terms in them that describe the direction of the muscle fibers. The word rectus comes from the word erect, meaning straight up and down. So your rectus abdominis goes straight up and down your abdominopelvic area. And the rectus femoris is this muscle over your femur that goes straight up and down. It's the primary muscle in your quadriceps group. So quadriceps means 4, and the other 3 muscles are vastus medialis, vastus lateralis, and vastus intermedius underneath it. So rectus femoris is the one that's going straight up and down, not the ones that are off to the sides. Sometimes the relative size of a muscle is incorporated into its name. You've got your gluteal group of muscles. The big one on humans is called the gluteus maximus. Underneath that one, sometimes you can see it peeking around the side a little bit, is the gluteus medius. And then you have a little tiny one that's even deeper than that called the gluteus minimus. What's kind of interesting about that muscle is that it's very large in humans because we use it to hold ourselves up in an erect position. Animals that walk on all fours don't use their gluteus muscles to hold them straight up, and so they have kind of a tiny gluteus maximus, and their gluteus medius is actually larger on them. So you can tell that we're the ones who made the names up on that. The location is often described in relation to the bone or the region. Temporalis is right on your temporal bone, frontalis right on your frontal bone, occipitalis right on your occipital bone. Those are a piece of cake. Sometimes the name will incorporate the number of origins. The triceps brachii has 3 origins, or it's called 3 heads on it. The biceps brachii has 2. The location of the origin and insertion may be part of its name. This muscle that goes from the mastoid process behind your ear of your temporal bone down to where your sternum and your clavicle join is called the sternocleidomastoid. You can find that muscle if you tip your head and look to a side. It'll protrude and you can even palpate it and feel it going along. Sometimes the shape of the muscle will be incorporated into its name. The deltoid is kind of shaped like a triangle, which if you are going to a sorority or fraternity, you may be becoming familiar with all the Greek letters, or if you're in a lot of math or physics classes, you may use a delta symbol for change. Pronator quadratus has its name. It's in your forearm, and it causes you to pronate your forearm, and it's shaped like a little quadrilateral. It isn't quad because there are 4 muscles in the group, like your quadriceps group in your. Sometimes a muscle's name incorporates the action that it performs in it. For example, a lot of the muscles on the posterior side of your lower arm function to extend your hand and extend at the wrist. Whereas the muscles on the opposite side, on the anterior or ventral side, when they contract, they will flex your wrist, flex your hand at your wrist. So when you're talking about the actions, sometimes you're going to mention the joint that's being crossed. Sometimes you're going to mention the part that's being moved, the insertion area. A lot of those muscles in your lower arm have very long names, but they actually tell you quite a bit about what that muscle does, where it is, what it looks like. For example, here's your extensor carpi ulnaris. Notice it's on the posterior side of your arm, and excuse me, it is on the pinky side or the ulna side of your arm. Whereas the extensor carpi radialis, there's 2 of them, a long one and a short one, they're located on the radial side. So those muscles, sometimes in addition to just doing the action of extending, they can also help make your hand move medially or laterally, and abducted or adducted. The forearm on the anterior side then has a bunch of flexors because that's where those are mostly located. And they also tell you things like flexor carpi ulnaris is on the pinky side, flexor carpi radialis is on the thumb side. So that helps you figure out where they are. Diagrams of your body when it doesn't have the skin on can be confusing. It's not so easy to tell when you're looking at the front or the back of something. So make sure that you pay attention to these descriptive terms that show you which aspect, the anterior or posterior aspect, that view is from.